Have you ever wondered how primary aldosteronism affects our body's electrolyte balance? Imagine your adrenal glands, tiny little powerhouses perched atop your kidneys, producing an excess of the hormone aldosterone. This condition is known as primary aldosteronism, and it's more influential on your health than you might think. Aldosterone is a bit of a puppet master when it comes to electrolyte balance. It dictates how much sodium your kidneys retain, and in turn how much potassium they let go. The more aldosterone in your system, the more sodium is conserved, and the more potassium is expelled. It's a delicate balance, and when aldosterone levels rise, it can tip the scales, leading to a host of health problems. So primary aldosteronism isn't just about overactive adrenal glands, it's about the knock-on effects this condition can have on the body's complex electrolyte balance. So primary aldosteronism can significantly disrupt the body's electrolyte balance, leading to various health complications. Now, imagine a specific case of primary aldosteronism known as Conn syndrome. This disorder is named after the physician Jerome Conn, who first described it in the mid-20th century. Its main feature is the overproduction of aldosterone, a hormone produced by the adrenal glands, which are small triangular organs located on top of your kidneys. In a healthy body, aldosterone plays a crucial role in maintaining electrolyte balance. It signals the kidneys to retain sodium and water and to excrete potassium. This delicate dance of ions is necessary for maintaining blood pressure and the body's fluid balance. However, with Conn syndrome, this balance is thrown off-kilter due to the excess aldosterone. In Conn syndrome, one or both adrenal glands produce too much aldosterone. This overproduction can be caused by a benign tumor called an adenoma, or by a condition called adrenal hyperplasia, where the adrenal glands become enlarged. Regardless of the cause, the result is the same: too much aldosterone circulating in the bloodstream. Excess aldosterone in the bloodstream leads to a host of problems. It prompts the kidneys to hold on to too much sodium and water, leading to high blood pressure or hypertension. At the same time, it causes the kidneys to excrete too much potassium. Low potassium levels, or hypokalemia, can cause muscle weakness, irregular heartbeat, and fatigue. The imbalance of sodium and potassium in the body can also lead to metabolic alkalosis, a condition where the body's fluids become too alkaline. This can cause symptoms such as nausea, muscle twitching, and hand tremors. In essence, Conn syndrome is a specific type of primary aldosteronism that has significant effects on our body's electrolyte balance. It's a fascinating and complex condition, one that reminds us of the intricate interwoven systems that keep our bodies functioning smoothly. As we delve deeper into Conn syndrome, we'll explore how it's diagnosed, managed, and what it means for those living with this condition. But remember, the journey to understanding starts with a single step, and that step is recognizing the importance of balance in electrolytes and in life. What causes Conn syndrome, you might ask? Well, the root of this condition lies within the adrenal glands, small but mighty organs that sit atop your kidneys. They're responsible for producing a host of vital hormones, one of which is aldosterone. Now in Conn syndrome, there's an overproduction of aldosterone, often due to an adrenal adenoma, which is a benign tumor, or adrenal hyperplasia, an abnormal increase in the adrenal gland cells. This overproduction of aldosterone throws a wrench into the works of the renin-angiotensin-aldosterone system, or RAAS for short. The RAS is a complex hormone system that helps regulate long-term blood pressure and the balance of fluids and electrolytes in your body. In Conn syndrome, this system is dysregulated, leading to an excess of aldosterone, which in turn triggers a cascade of physiological changes. So Conn syndrome can be traced back to issues within the adrenal glands and the RAAS. So, what signs should we look for when suspecting Conn syndrome? Well, Conn syndrome, a type of primary aldosteronism, is typically characterized by a triad of symptoms: hypertension, hyperkalemia, and metabolic alkalosis. Let's unpack these a bit, shall we? First off, hypertension or high blood pressure is the most common symptom seen in Conn syndrome. This is because the excess aldosterone produced prompts the kidneys to retain sodium and water, thereby increasing blood volume and pressure. However, it's worth noting that the hypertension seen in Conn syndrome is often resistant to conventional antihypertensive therapy. Next up is hypokalemia, which is a lower than normal level of potassium in the bloodstream. You see, the excess aldosterone also prompts the kidneys to excrete potassium, leading to its depletion. This can manifest in a range of symptoms, from muscle weakness and fatigue to more severe effects such as cardiac arrhythmias. Lastly, we have metabolic alkalosis, a condition where the body's pH balance leans toward being too alkaline. This results from the increased excretion of hydrogen ions alongside potassium, again, due to our culprit excess aldosterone. While these three are the hallmark symptoms, Conn syndrome may also present with other symptoms. These can include headaches, excessive thirst and urination, and in severe cases, even paralysis. It's also worth noting that many individuals with Conn syndrome may be asymptomatic or present with non-specific symptoms, which can make the condition quite challenging to diagnose. As we continue to explore this condition, it's important to remember that these symptoms aren't exclusive to Conn syndrome. They can occur in various other health conditions. Therefore, recognizing these symptoms and understanding their potential link to Conn syndrome can play a key role in prompting further diagnostic investigation. In sum, if a patient presents with resistant hypertension, hyperkalemia, and metabolic alkalosis, Conn syndrome might be a condition worth considering in your differential diagnosis. Recognizing these symptoms early is crucial for effective management of Conn syndrome. How do we confirm a diagnosis of Conn syndrome? Diagnosing Conn syndrome is a step-by-step process that involves a combination of clinical assessments, laboratory tests, and imaging studies. The first step towards diagnosis is often a blood test. Elevated levels of aldosterone and decreased levels of renin in the blood can be indicative of Conn syndrome. However, as these are not exclusive markers, additional tests are required to confirm the diagnosis. Moving on, a confirmatory aldosterone suppression test is performed. This involves administering a salt loading test, where the patient is given a high-salt diet or salt tablets. In a typical response, the body would suppress aldosterone production due to the increased salt intake. However, in Conn syndrome, aldosterone levels remain stubbornly high, revealing the body's failure to suppress aldosterone production. Imaging studies such as computed tomography, CT scans, or magnetic resonance imaging, MRI, can then be used to visualize the adrenal glands. These scans can often detect the presence of an adenoma or hyperplasia, which are common causes of Conn syndrome. It's essential to note that not all adenomas cause Conn syndrome, and not all individuals with the syndrome have visible adenomas. Hence, these imaging studies serve as an adjunct to biochemical testing, not as a standalone diagnostic tool. An important aspect of Conn syndrome diagnosis is differentiating between unilateral and bilateral adrenal involvement. This differentiation is crucial as it significantly influences the treatment approach. Unilateral involvement, where only one adrenal gland is affected, usually points towards an adrenal adenoma. In such cases, surgical removal of the affected gland is often the preferred course of action. On the other hand, bilateral adrenal hyperplasia, where both glands are involved, is typically managed with medication to block the effects of excess aldosterone. In conclusion, diagnosing Conn syndrome is a meticulous process that combines clinical, biochemical, and radiological data. It's a journey of discovery, from the initial suspicion raised by symptoms such as hypertension and hyperkalemia, to the definitive confirmation through a series of tests and imaging studies. Proper diagnosis is key in determining the most effective treatment plan for Conn syndrome. Once diagnosed, how do we manage Conn syndrome? Well, the answer is not a one-size-fits-all solution. The management strategies for Conn syndrome are as diverse as the individuals who carry this diagnosis. It's all about tailoring the treatment to the specific cause and severity of the condition. For some, medical therapy may be the best course of action. This typically involves the use of medications designed to block the effects of excess aldosterone. One such class of drugs is the mineralocorticoid receptor antagonists, which includes medications like spironolactone and eplerenone. These work by preventing aldosterone from binding to its receptors, thus mitigating its impact on sodium and potassium balance. But what about those for whom medical therapy isn't enough? For these individuals, surgery may be the most effective approach. This is particularly true in cases where the excess aldosterone is being produced by a tumor in one of the adrenal glands, a condition known as an adrenal adenoma. In these cases, a procedure known as adrenalectomy can be performed. This involves the surgical removal of the affected adrenal gland. The beauty of this is that the body can function perfectly well with just one adrenal gland, so the removal of one doesn't significantly impact the body's ability to maintain hormonal balance. Of course, all this is not to say that managing Conn syndrome is a walk in the park. It requires careful monitoring and regular follow-ups to ensure that the treatment is working and that the body's electrolyte levels remain stable. It's also important to remember that everyone's journey with Conn syndrome is unique. What works for one person may not work for another, and that's okay. The key is to work closely with healthcare professionals to develop a treatment plan that best suits the individual's needs and lifestyle. And finally, it's crucial to keep in mind that managing Conn syndrome is not just about treating the physical symptoms. It's about addressing the mental and emotional impact as well. So don't forget the importance of psychological support and self-care in this journey. With the right management strategies, patients with Conn syndrome can lead healthy and normal lives. Let's quickly recap what we've learned about Conn syndrome. Firstly, we delved into primary aldosteronism, where excess aldosterone disrupts the delicate balance of sodium and potassium in our bodies. Specifically, Conn syndrome, a subtype of primary aldosteronism, results from an overproduction of aldosterone, often caused by adrenal adenomas or hyperplasia. This syndrome manifests through symptoms like hypertension, hyperkalemia, and metabolic alkalosis. It's crucial to remember that diagnosing Conn syndrome involves a range of tools from blood tests and imaging studies to confirmatory aldosterone suppression tests. Differentiating between unilateral and bilateral adrenal involvement is essential for tailoring the most effective management strategies. These can include medical therapy or surgical options, depending on the patient's specific condition. Understanding Conn syndrome helps us appreciate the intricate balance of hormones and electrolytes in our bodies. It's a testament to the complexity of endocrine regulation and the importance of maintaining this balance for optimal health.